Well, it does feel like we have hit somewhat of a plateau, at least for the moment in Victoria. Cases still in the low 200s or mid 200s, 238 today. And we're sort of seeing, fairly constant, although, with a little bit of variation through for the past week. The other thing I'm keeping an eye on at the moment is the number of, the percentage of tests in Victoria that come back positive. And they're also remaining, the same sort of rough ballpark at the moment across the state. Elevated higher than we would like, but at least not going up, and hopefully that will start to come down soon. So hopefully, fingers crossed, we do start to see this firm into a stabilisation, into a sort of trend downwards, but I think it will probably take some time to get back to very low numbers, but hopefully we start to see that fairly soon as the stay-at-home orders, we start to see the effect of those. One thing I'll just show you is this mobility index that Apple's been publishing, which gives you the number of people looking for directions with Apple's Maps app indexed against pre-pandemic times. Obviously, we know exactly what happened in March as people stopped going out and stopped moving beyond their house. As restrictions eased, people started moving around more, and we are now seeing the effect of these stay-at-home orders again, but we're not yet seeing the complete effect of that in the actual figures. The other thing we're keeping an eye on in Victoria is the hospitalisation rate, and sadly that is looking very nasty. 105 people now in hospital in Victoria. That's 20 higher than yesterday. The numbers are not going in the right direction there, and they won't be for some time because of the big numbers that we're seeing. We're also seeing one of the reasons this number's gone up a bit, quite a bit in the last couple of days, is that residents of aged care homes are being moved into hospitals, both to treat them and to isolate them from other residents of homes where there has been spread. More than 80, I think now, residents of aged care homes in Victoria have been infected in this round of infections. That's not something we'd like to see.
I just want to talk about the sort of beginnings or the source of this outbreak in Victoria. There were some newspaper reports this morning about the link between the Black Lives Matter protests and the clusters in Victoria's public housing towers. I know that you've given this some analysis, and I think it's important because there's been a lot of political debate around this protest, which of course, broke with the rules. What can you tell us about that link?
Well, yeah, there was a sort of slightly curious story in some ways through some newspapers today, which talked about there being a link between this Black Lives Matter protest and the public housing towers. Didn't go into much detail on what that link was. Well, the Victorian Health Department has today told me that there have been 6 people who attended that protest who have subsequently tested positive with coronavirus. None of those are believed to have acquired the infection at the protest, and indeed none of them live in a major public housing tower. So I'm not quite sure what the link is, but certainly it does not seem that there's any strong evidence that this protest, still no strong evidence that this protest, or even really much weak evidence either, that this protest has spread this virus in any significant way. Compare that against, we do have a much more credible theory, and that appears to be borne out by the genomic sequencing done by the Victorian government. We don't know all of the details of that. We don't know exactly what extent, exactly what the risks were there, and how whether all of the infection can be traced back to this one point of failure in the hotel quarantines, overseas virus coming in through an overseas arrival and leaking out of the hotels. It seems that that's the single biggest factor in this wave at the moment. It's spread from the hotels into family clusters and then through the community. It doesn't appear that the Black Lives Matter protest has any significant impact, or at least there is certainly no evidence of it to date.
No, that's right. It's about the evidence. Look, let's just talk about the Crossroads cluster in New South Wales. We did speak to an epidemiologist about this a little earlier, whether this is now under control. What's your analysis of how that cluster is growing?
I think my unsatisfying answer to you, Patricia, is I don't know if this cluster is under control, but let's just have a look at the charts very quickly. What we're seeing in New South Wales is, broadly a similar number of infections that we've been seeing for a couple of weeks now, but the big difference is most of them are now locally acquired. So if I just remove all of the overseas acquired, those hotel quarantine cases, we see this elevation. It's not as big as, we're not seeing like what we're seeing in Victoria at the moment, where the peak is far bigger than the first one, but we are seeing the beginnings of something that has the potential to become a problem. 10 locally acquired cases every day. Now, just remember, on Friday, this cluster was two cases. It's now 34. This cluster's growing quickly. That is, in my view, actually a good thing. The faster you find the cases, the more chance you have of stopping the transmission. But the big question is, has it spread beyond the Crossroads Hotel and sort of the associated links that have already been found? We know now there are several cases of tertiary infection, and by that I mean they are close contacts of a person that attended the venue. As you start to get into those subsequent generations of virus, you start to run the very real risk, the very likely risk that you start to lose control of it. So is it under control? We don't know yet, and we'll only know it's not under control really if more clusters crop up or more infections in that area crop up that can't be traced back to a source of infection. So I think, unsatisfyingly, we need to wait a few more days to see exactly what's going on there. It's good that the numbers aren't growing. We have seen a lot of testing in southwest Sydney in the last few days. That's all very good. The New South Wales government have moved faster to try and contain this than we've seen for most other clusters in the country. That's a good thing. But we are, on the flip side of that, seeing tertiary infections, and we're seeing this in a venue that's quite tricky to contain. It's big and people travel far and wide to and from it. So there's a lot of risk factors there. It's not easy to compare to Melbourne's situation.